All right. Hi, Saran. How are you?
I'm awesome. I'm doing well. How are you?
I'm doing well. We were just talking off air on she's in Canada and I am in Boston, and how in this type of weather, not warm at all, we've been bundling up to get outside for our daily walks.
Absolutely. Not shy about it, not trying to look cute,
Yep.
putting the snow pants on, in the whole bit.
Yeah.
And actually, you start to really warm up. You start to really warm up once you get going.
Hmm.
So sometimes I kind of regret putting so much on, depending on the pace and how far I get.
Hmm.
But yeah, it's still, even though it feels cold, like it's still good to get that fresh air in and a little bit of sunlight, especially now.
Yeah,
Yeah.
definitely. So, Saran is a holistic nutrition practitioner and an herbalist, and your primary focus is helping women support optimal hormone balance, reproductive health, reduce stress, and live according to their natural rhythms and cycles.
Yes, that's a perfect summary.
I nailed it. So that's amazing. I mean, obviously, as a female, I can absolutely respect your work. And as someone who specializes in gut health, I can't talk about gut health without bringing in, the conversation of hormones. And I've done previous episodes on the importance of hormone balance. What is it that got you interested into this field? Obviously, other than being a female, but what is it that got you interested into what you do now?
So once I actually started this area of study, so holistic nutrition was sort of the gateway to everything else. But once I started seeing clients, most of them were women, and they weren't just coming in because they wanted to lose weight,
Mm,
or even if they wanted to lose weight, there was underlying issues that were hormone related. So I ended up doing a lot more study and a lot more work around, okay, the root causes, balancing hormones, what is the optimal nutrition to support that. So it kind of ended up evolving naturally. It wasn't on purpose that I decided to work specifically in, reproductive health and wellness. It just ended up being that way because of who was coming to me and what they were dealing with. And of course, it just got me really curious as well. I didn't typically have reproductive health issues. I have 3 children myself. I didn't have any issues with conceiving them. Yes, when I was younger, you have menstrual cramps and, you know, my cycle was kind of heavy, but I didn't have any like overt issues.
mm,
There were some shifts that I noticed once I got to my early 30s, though, which I think is really common with a lot of women.
mm.
Something kind of happens around like 32, 33, 34. And, you start to maybe notice some symptoms, right?
Mm,
So for me, that was just a little bit longer cycles, not extreme,
mm.
but it didn't take too much for me to just adjust and everything come into balance. So when I tell people that, I don't have cramps, they look at me funny, like, how? And I'm like, it's actually possible to have pain-free periods. It's actually possible to not have like a really heavy flow. You just, once you start to understand and know your body and know what you need to support that, then, it can be a lot easier.
Wow. Well, that's amazing. And I think it's so great that you've been meeting the needs of the people that are coming to you and seeking advice from you, which is amazing. And it's funny because whenever I talk to clients, I'll say, okay, and tell me about your menstrual cycle. And they'll say, oh, it's fine. I get my cramps and some headaches and PMS symptoms, stuff like that, but the usual. And I think we've become so accustomed to considering that as being normal when, as you just mentioned, people don't realize that those things are usually a sign that there's something underlying, some root cause that needs to be addressed. And we'll definitely dive more into that today as we talk about polycystic ovarian syndrome, which, it was funny. I did a poll last night, and I said, what are some things that you guys want to, like, questions that you have? I'm doing an episode on this tomorrow. And my boyfriend says, "What's POCS?" And so I said, "That's a great place to start." Let's start with, what is it? What is polycystic ovarian syndrome? So I'll let you take this one.
So the name doesn't necessarily indicate what it is. It's actually quite complex. So polycystic ovaries, you at first thought you'll think, oh, I have cysts on my ovaries, right?
Hmm.
But that's not necessarily the case. Not all. Right. Okay. So polycystic ovarian system is quite complex. It's usually diagnosed by looking at, different symptoms, but within that, there's different types of PCOS. So some people will have cystic ovaries, meaning that they have multiple follicles that are not maturing all the way. There's not one dominant follicle. But then there's also inflammatory PCOS, which is associated with insulin resistance.
Mm.
And then there is adrenal PCOS. So typically, folks might have higher androgens. And with adrenal PCOS, DHEA specifically is elevated,
Mm.
and not necessarily the other androgens like testosterone. And then you have post-pill PCOS. So if you're on the birth control pill for a long time, then you can develop those symptoms. But typically it is, if you're having irregular cycles, so very long cycles,
Mhm.
you're not ovulating, that's basically one of the hallmarks of PCOS. And again, and as I mentioned before, elevated androgens, so male hormones, sometimes that looks like excessive facial hair or body hair. Um, there's a lot of different factors there when trying to determine what that is. So typically a person might go to their doctor who is not ovulating and saying, I don't know what's wrong. And then they'll start to do that investigative work. They'll do the blood panels to check the androgens, check your blood sugar, and sort of go from there.
Yeah, there's a lot of nuance, I feel, to the diagnosis of this. And as you just went through, there's different kinds. And I think every doctor might have their own approach to how they diagnose it, or what their criteria is for giving you the diagnosis. Because I can personally speak to my own experience. I had hypothalamic amenorrhea. And so I did have cysts on the ovaries at one point, and they diagnosed me with PCOS, but it was really hypothalamic amenorrhea. So there's so many clients who come to me who will say, my doctor diagnosed me with PCOS, and then I'll ask them, well, did you have high androgens, or did they do an ultrasound? Did they find that you have cysts? And they'll say, well, no, I mean, they didn't do any of that. They just told me that because I'm not getting a regular period, I don't have it. So I think it becomes confusing as the person who's sitting in the patient's seat, where they don't have the education to understand that, and they're, like you just mentioned, there's so many different nuances to it.
Well, and that's one of the things too. So in that case, when there's no cysts on the ovaries, there's, blood sugar is normal. Then you look at the androgens, right?
Mhm.
But typically, even if it might be adrenal PCOS, and so when it's adrenal PCOS, it's definitely linked to stress,
Mm.
right? Because the HPA axis is involved with that. So the DHEA is typically elevated while the other ones are maybe normal level, right? So with clients like that, you definitely want to, look at the nervous system first, but we'll go into
Yeah, yeah,
what that might look like. But yeah.
definitely. So some other symptoms that you see that are really common. I know for a lot of my clients, they'll say, I'm working out like 7 days a week. I'm eating so well and I'm not losing weight. I'm actually more tired. Those are some common symptoms that I see. What are some that you see in your practice?
The same. So weight gain and weight gain, cystic acne. So I have one client now who's actually really struggling with that part of it. It's really challenging, and that a lot of the androgens actually drive that bit of it, and it really can do so much damage to self-image if there's a lot of acne or facial hair, or hair loss is another symptom as well that is common. And so, it's there's a whole component where it comes to the mind that I
Mm,
really kind of work through with clients, and self-image and self-acceptance, because it really does affect that. It's not just that you are doing everything you can. I'm doing all the things, like usually that's what it is, right? I'm doing all the things, right? I'm not, I'm cutting out sugar, and I'm not, I think my diet is fine. I took all these things out. I'm exercising. So then we go a little bit further. Well, what type of exercise are you doing? Are you just trying to do cardio?
mm,
You know, PCOS responds better to slow weight bearing exercise as opposed to a lot of cardio, for
mhm.
example. So we look at different things and different approaches, but that mental, emotional piece is really important.
Yeah. Yeah. So you mentioned the acne. That is also a really common one that I see. And then, headaches this gets into so much overlap, right? Because these things can be caused by anything, but
Yes.
missed periods, so fewer than 8 total per year, prolonged periods, heavy menstrual bleeding, thinning hair or baldness, trouble getting pregnant, trouble sleeping, pelvic pain, moodiness. All of those
But
things.
there's a lot of overlap there, right?
Yeah.
As you mentioned, there's so much overlap. So there's so many things that could be causing that. And fatigue, chronic fatigue, which is why, again, we always, look at the HPA axis and supporting that. And that actually really helps. I mean, I've had clients who, are able to get pregnant, who, the whole point of them coming to me was, I want to have a baby, but my doctor says I have PCOS. What can I do?
Mhm.
Um, the other thing that I actually noticed too, with some folks with PCOS, is high triglyceride levels as well.
Mm.
But that goes hand in hand with blood sugar issues. So, there are certain types of, depending on the root cause, um, you know, really drilling down on the diet and nutrition is extremely supportive. With some people, it has a lot to do with lifestyle and what's happening in their, psychospiritual and emotional environment.
Mm. So that was actually going to be my next topic for you is, okay, so what causes PCOS? Like, how does somebody get to the point where it's impacting their life in such a negative way? I know you mentioned, so stress, the HPA axis can play a huge role. And then lifestyle, which we'll definitely get into in more detail. I know there's a little bit of a genetic component in there as well, just based
I
on
was
some
just
of the
gonna say there's a
research.
genetic component.
Okay. So yeah,
Yeah,
can you
there's a
speak
genetic
more
component as well. Yeah.
on just kind of
So
like what causes
if
it?
there's a right. So if there's a genetic component, we often think that we don't have control of our genes, right? That once we have a predisposition to something, then that means that, the writing is on the wall for us. But, there's studies in epigenetics that say otherwise. If you are not triggering the gene expression, then those things will not necessarily, come up as an issue. So we tend to do a little bit of a deep dive into family history. So if you had a parent or a mother who struggled with fertility, or a grandparent, whatever it is, we look at that. We look at lifestyle and culture as well.
Mm.
There's a lot around that that I could speak on. So I'm trying to think of, okay, if I'll speak on it here, I'll just leave that piece a bit towards the end. And then lifestyle. So if you've had any kind of traumatic experience, and there are studies that show that there's a link between, you know, chronic stress in the in puberty, so right around when the start of a cycle,
Mm.
and the PCOS development later on. Okay,
Wow.
so when I work with clients, I often do a timeline, and I will, you know, starting from birth till their present age, and we look at, you know, particular milestones. And I really ask them to focus in if they can remember what was happening with them in their, you know, home environment, or, you know, anything else around that time of puberty. And if they can recall anything, we kind of try to, you know, work with that and see how that is playing out. A lot of those habits and the thoughts around what it means um, to be feminine, if you will. I don't really want to, I'm not using it in terms of being gender specific, but I mean
Sure.
just what it means to come into adulthood through that rite of passage, right? When you first start your period, what were the feelings around that, right? That has a huge impact on it. So when we look at lifestyle, a lot of that is cemented from those early ages. How are you, what's your body, was your body image? Was weight always a struggle? I can almost guarantee that a lot of folks who have issues with PCOS, there was a lot of self-image issues early on in puberty. So
Mm.
really dealing with that aspect of it is really important.
And that's interesting too, because some of the research that I was looking at prior to this that was more specific to something else and completely, but there was a lot of discussion about, eating disorders and the link between disordered eating, and some studies showing that normalizing eating patterns, patients who had bulimia or binge eating disorder, ways that they can improve cysts and things like that, and those populations being more vulnerable. So it ties right into what you were just saying.
Absolutely. So here's another interesting one
Mm,
that I've observed is the relationship between being and doing. So sometimes clients who have very high stress jobs, or even jobs that are very masculine dominated, like engineering, or something like that, and they're used to being in a particular energy, and they need it actually to to be able to do the jobs that they're doing. Sometimes there's that imbalance that happens too, that reflects in in the hormones.
wow.
So really, I focus a lot on cultivating a different energy, or creating that balance in that energy,
Mm,
um, emotionally and spiritually as well. Because especially if they're looking at becoming pregnant, we talk about what it is to nurture something, um, to be receptive, compassionate, and developing those self-compassion, especially. How can you cultivate those things to help to create that balance? Because a lot of it really is mental and emotional.
and you're not saying, oh, it's all in your head. You're saying there's a
No,
relationship right there with yourself, and how you carry yourself, talk to yourself, treat yourself, which is absolutely beautiful. And we're going to talk about all the things, right? We're going to talk about medications and lifestyle, but that, I think, I love that you led with that. And because it is so important, not just of course with hormones and PCOS in specifically, but overall health. I mean, better than anybody. It's the front of the line of the work that you do, and I think that's absolutely amazing.
absolutely, absolutely. So we look at the relationship with food. So we're talking about lifestyle,
Hmm.
right? So we're looking at relationships with food. There's sometimes disordered relationships with food, or you know, being chastised early on
Hmm.
in puberty around their relationship with food. So coming into balance with that, and not being hard on yourself when you're making certain decisions, because that it's a bit of a cycle. I'm doing everything, I'm making all the changes, it's not working.
Mm.
So going back to the things that are comfortable, right? Provide the most comfort. And, you know, sweets and, you know, chocolate and, you know, starchy foods, those are all things that really provide some level of comfort. But they also, if you have maybe insulin related PCOS, can exacerbate that. So we're looking at how can we remineralize the body? How can we find comfort in other ways? You know, everybody has different coping mechanisms, and really challenging, you know, folks to find that self-compassion piece as you go on this journey, because it's not just um, it's not overnight. It's not an overnight process. And sometimes you think, okay, well, I saw this person on social media, and like you see their like weight loss pictures, right?
Yeah.
They're like holding the jeans out, and it's like, oh well, why can't I do that? Why is that not happening for me? And it takes a little bit more than that, right? And then it's like, well, should I just go on medication? Will that solve the problem? And then I always say, if your gas tank is on E and you have the light comes on, you don't just put black tape on it,
Mm.
right? You do what you need to, you fill the tank essentially. So just because you can't see it doesn't mean it goes away. And
Mm.
sometimes that's what happens when we take the medication. You take the medication and everything is fine, but once you take that stop taking that medication, then you know the symptoms are right back.
Yeah, I had a client actually who was on the, hormonal birth control, the oral contraceptive, and she had been managing, right, symptoms of PCOS with that oral contraceptive. And then, we were working on gut health specific things, and she had come to her own personal decision of trying to eliminate that. And since eliminating that, all her PCOS symptoms came back. And she said, well, now my symptoms are back. I said, well, the root cause never changed. The root cause was always there, but now you took the black tape off, is what you just said. And
Exactly.
yeah.
Exactly.
So can you speak to the other medications? So hormonal contraceptives, that's a big one that a doctor will prescribe for irregular cycles, or also I've seen it prescribed a lot for acne, or the excess hair growth and things like that. But what are some of the other medications that you see prescribed? And maybe we can just
The
briefly.
main one,
Yeah.
yep. The main one is that I mostly my clients are prescribed is metformin, um, especially if there's like the insulin resistance component to it, which is fine. It's actually a better option. I mean, when I say fine, I mean it's a better option than the hormonal birth control, because the hormonal birth control really just masks the symptoms.
Hmm.
You're not actually, you're still not ovulating. You know what I mean?
There's
It's
some
just
people don't
you're
even
controlling the
realize.
symptoms at, yeah, yeah. So you're experiencing an ovulation with PCOS, but when you are actually on hormonal birth control, you're also not uh, ovulating either. So metformin is a drug used to control blood sugar, or for blood sugar regulation, um, and is very commonly prescribed. What I've found with clients who are prescribed that and have said to me, I don't want to take metformin, or they may take it or say, how can I wean myself off of it? Um, Working very closely with their doctor, of course. I don't ever recommend coming off medication that has been prescribed by a medical doctor. Um, that's where dietary changes really come in. So once blood sugar levels are regulated or come into balance, so we're constantly monitoring blood sugar levels, and then we'll look at once they go to their doctor, and if the doctor says, okay, you seem stable now, you can consider to coming off of it. Um, then we look at herbal remedies that actually do the same or have the same effect as metformin in terms of helping to support blood sugar levels. The thing is though, if you're prescribed a medication, I really highly recommend that you are talking to your doctor about a plan. So it's not just about going on the medication. It's like, well, what's the plan for me? Like,
Mm.
how long, am I going to be on this medication for? And how are we working towards getting me off of it? Because that's ultimately, you don't want to be medicated for life if you can avoid it. So working with your doctor and saying, okay, I know this is what I need right now. How can I work towards getting off? What's the time frame? And what criteria do I have to meet in order to be considered, able to get off of it?
Mm. I don't know why my brain works like this. I think of like little analogies to describe it, but it makes me think of like teaching a baby or an infant to put a band-aid on and, instructing them when they need to take it off. It's kind of comparing to that example that you mentioned about putting the band-aid on. But I love that, and advocating for yourself and empowering your healthcare decision to be able to say, okay, we're a team here, work with your doctor, create that plan and have a set of actions that makes you feel really confident and hopeful as well. I think that can be really, really nice when you feel hopeful about what the end point of that medication might look like, if any at all.
Absolutely. And I think most of the time, metformin is prescribed when um, a person comes in and says they want to conceive, they're trying to get pregnant. That's the drug typically that they'll say. Otherwise, it's very common for hormonal birth control to be prescribed as well
So what are
to,
your thoughts
to
on
control the.
yeah, what are your thoughts on myo-inositol, which I know there are different types of this, but I've used it in my practice before, specifically with people who are looking to conceive, and have had actually some pretty good success with it without the side effects. But is there anything that you use in your practice that you found to be really beneficial?
So because I use a lot of herbal medicine, I look for herbs, specifically bitter herbs that have an action on the liver.
Okay.
And then Oregon grapefruit is an excellent one. Actually, there are studies on Oregon grapefruit and comparing it to metformin and its effects. So that it just depends on the client again, because with herbs, you really have to study the constitution of the person, other underlying factors, etc. But definitely I focus on bitter herbs, incorporating more bitter foods. That really helps to support the blood sugar regulation piece of it. But in inositol, of course, that one, I do have actually one client right now who takes that,
Mhm.
and that she finds very helpful.
That's great. Yeah, I'm
Yeah.
definitely not an expert in herbals by any means. So I'll have to get some more information from you and learn a little bit more about that. I believe in the practice of them, and I think that they can be incredibly powerful, as you know. But that's the main one that I will use with clients. And just for the listeners to
Berberine is also another one. Sorry,
okay.
berberine is also another. It's a constituent of herbs
Mhm.
that actually has a really it's very potent actually and works quite well. It's in a lot of formulas for blood sugar regulation and hormone balance.
Excellent.
So, and it's actually quite commonly used for PCOS as well.
Excellent. Thank you for that.
Yeah,
And I just wanted to
yeah.
make clear for the listeners that when I was saying that it's myo-inositol versus there's a D-chiro-inositol, which the D-chiro one improves the insulin sensitivity of non-ovarian tissues, while the myo-inositol specifically targets the ovaries. So it's important that you, as a consumer, make the differentiation and don't just go on Amazon and get yourself a supplement off the dark web. You want to work with a professional and make sure that you're getting the right thing. So
Absolutely.
you mentioned, the insulin resistant form of PCOS. Now, I, I'm picturing the typical scenario is you're diagnosed with PCOS. You don't know anything about it. You don't know what maybe the root cause is. You go to Google and there's all this talk about managing blood sugar and watching out for sugar and starchy carbohydrates. And so I think a lot of the first reaction is, okay, so I have to cut out carbohydrates. And then you'll see like exercise. So then they say, okay, and I have to exercise. And those things two together, I mean, hello, that's like a storm for stress on the body, right? So
Absolutely.
what would you say to somebody who came to you and said, "Okay, I just read that I have to go low carb. I need to start working out more. Treat me like one of your clients." What would you say to them in a obviously very broad term to kind of help educate the listener?
Okay, so I typically um, start again with a psychospiritual emotional piece because I feel like that sets the foundation,
Mhm.
right? And we go through quite a few exercises to help support that. Then the next step would be looking at a diet. So maybe doing a diet diary, not making drastic changes all at once, because like you mentioned, that will really add to the stress. So making very simple changes at first while we work on the psychospiritual emotional piece. So that is like simple changes. Um, so if there's a lot of sugar, processed foods, saying how can we reduce that in the beginning? Can you cook more foods? Because some people don't even cook, right? Their own meals. Right? So really starting there, what foods do you like? What vegetables are tolerable to you? What do you not just kind of going on the internet, like you said, and taking a diet plan off because that might not work. You might not like broccoli or
Mm,
cauliflower. So what are the ones that you like that you can incorporate and you will eat happily? So it's
mhm.
again cultivating a different relationship with food, right?
Yeah.
So once you can make those small changes, then we can go do something a little bit more, right? So we can look at what the plate composition looks like.
Mm,
um, you know, can we make a switch? Well, if you're used to eating a lot of white rice, for example, can we switch to a whole grain? Which ones do you like? Really experimenting, really playing around. So not just the diagnosis is sort of like the back of the mind,
mm,
right? And really looking at cultivating better relationships with food and educating about what is in the food, what nutrients are important. Of course, there's certain supplements that I typically like to suggest right off the bat if they're not taking any. So a B complex, for sure,
mhm.
magnesium, zinc, just ones like that to really support the body. And depending on what's happening, a digestive enzyme, probiotic. But again, not going too crazy with all the supplements in the beginning, just kind of gradually, going in and seeing what is needed.
Yeah, and a lot of the things you just mentioned too, it might sound like a lot to the listener, but those are things that you could find in a really good high quality multivitamin. Those are basic essentials. Those are things that your body needs that we typically don't get a lot of things like you mentioned magnesium. We don't get a lot of because of the depletion in our soil, or just
Right.
our typical food choices. So I think that's a really excellent approach. And I've done a quite a bit of research between the link between gut health and PCOS, and how the benefits of gut health are of course endless in terms of how you can manage symptoms and also the prognosis of it. And it makes sense because there's plenty of research that shows how the gut bacteria is linked to insulin control. There's plenty of research that shows that the gut is linked to inflammation in the body, and so all of the things that the gut is connected to are also connected to PCOS. And so taking a probiotic can be great, and it can help your body naturally detox estrogen if you have enough of that beta glucuronidase enzyme, for instance. So that's excellent. I think that we definitely can agree on that gut health focus for sure.
Absolutely. And there's a lot, oftentimes there's that intestinal permeability that's happening. So that gut repair eventually, is part of the protocol, because that is going to lead to a lot more inflammation in the body if there's intestinal permeability. So, looking at, allergenic foods and trying to reduce that as much as possible, of course, all of those things are going to help with that inflammatory response.
Yeah. Yeah, there's a lot of things on social media where people will say, go gluten-free and dairy-free. And I can personally say that I'm not dogmatic. I don't have one diet that I prescribe to for my clients. But I think naturally when you start eating in a more balanced way and you start eating more whole foods, you naturally are eating less processed gluten products. You're eating less processed conventional dairy. And so we can get into the research, we can dig all day and have conversations about it. But at the end of the day, we know that a whole food balanced diet, like, mostly full of plants and plenty of protein from all types of sources, is supportive of decreasing inflammation, balancing hormones, improving mental health. The list goes on, right? So we can get into the nitty gritty of,
Absolutely.
is it gluten free? Is it lectin free? Is it, vegan? It's a balanced whole food, diet as much as possible, and not demonizing foods. I love how you keep bringing into that aspect of that relation to that mental health aspect of it. You don't want to demonize these foods that can add to stress. So, it's all about balance at the end of the day, which isn't sexy. People don't like to hear that. They don't like to hear that it's all about balance.
Absolutely. And it's so interesting too, because we know that when we're experiencing high levels of stress, where our digestive systems are turned off. So sometimes it's not even that you're necessarily allergic or having an allergic reaction to food or a sensitivity, but because you're in a state of chronic stress, you're actually not digesting well,
Part
right?
of
So sometimes I've found that for myself personally, right? Um, digest things that I can eat when I'm not stressed um, are different than things I can eat when I am stressed. You know what I mean? My diet has to be really simple if I'm going through a stressful period. I
Mhm.
can't, my body can't take a lot of different things. But if I'm pretty calm, relaxed, everything's going great, everything, like I can pretty much eat anything.
Yeah.
So that's a big part of it.
It's so funny that you say that too, because I have this theory, because I can speak to that for sure. I'll specifically, I have like FODMAPs, for instance, that are big triggers for me, like dried fruits and things like that, that if I'm in a stressful period, which is, pretty frequent in my life right now, I think a lot of people are going through stressful times. I definitely notice a direct impact with that. And so my theory is, how people say, they go to France or Italy if they're fortunate to do so, whatever, and they'll say, well, I ate gluten and dairy there and I didn't have any digestive issues. And it must be because the US is putting, stuff in their food that's toxic. And, I have my issues with the food industry here, but could it also be that you were on vacation and you allowed yourself to eat bread because you were in Italy, which you knew you couldn't avoid doing, because how could you go to Italy or France and say you didn't eat the pasta, the bread, the cheese? And could it have been that you were just more relaxed and you were on vacation?
Absolutely. I totally agree. That's exactly it. That's
Yeah,
exactly it.
I'm glad you
So,
agree.
you know, that part of it is so important, the rest and digest. How can we get you into that place? Because that makes things way easier, you know? So addressing the nervous system, bringing that energy down. I actually just posted on my on Instagram an IGTV video about herbs that are specific for the central nervous system, and how important that is for supporting reproductive health in general, because you're moving the energy from up here down,
Yeah. Wow.
right? So you can digest, you know. So your adrenal glands, you're not in fight or flight constantly, you know what I mean? It all really helps.
I'm going to check that post out as soon as we hop off here. And you mentioned fight or flight, which is a perfect time to talk about exercise, right? So second aspect of it is movement, right? Moving our bodies, and we know that movement is good, but we also know that too much movement, especially with PCOS, is not good. So can you talk about what's the best type of exercise to do if you have PCOS? What's the worst, and what are signs? Well, I know I'm loading you up here. I'll remember the last one. What are some signs that you're overdoing it?
Okay, so the typical recommendation is slow, low impact, weight bearing exercise.
Mhm.
But again, that can cause even more inflammation. So making sure that you have sufficient amounts of vitamin C in your diet to help with the inflammatory response. If you're going to be working out, I wouldn't, working out hard 5 days a week is not something I would necessarily suggest. But like food, you want to do exercises that you can do fairly consistently, that you like. So for some women, that might look like um, a, a yoga class, right?
Mm.
A vinyasa yoga class. For some women, it might be a yin yoga class. You still want to be moving your body and training your body to, um, you know, use energy in a particular way. But I always emphasize, what do you like? Like if you're not a runner, like that's not going to be a thing. Now that you've got a PCOS diagnosis, you're not going to overnight become a runner, but what do you enjoy? So I have some clients who love Zumba, they love to dance,
Mm.
and that form of exercise really is helpful because there's that mental connection as well. They're not doing it because they have PCOS, they're doing it because they like to dance and they know that it is supporting their overall efforts, right, to heal. Um, sorry, I'm trying to remember
No,
the questions you
I can
give
help you
me.
with that too. But it's so funny. I'm thinking about anytime I've ever been to the gym and you look at the people in the Zumba class, right? And they're smiling, they're energized, like they're whipping their head back
Yes,
and forth, like that you can just tell they feel good. And I recently started incorporating more dance into my physical activity. And man, is it it is empowering. Like you feel, I mean, this is personally, but it speaks to, I was smiling, I was laughing, I felt like just so good in my body after doing it. And I feel the same way when I do lift weights sometimes or do yoga sometimes. Like it is so important to tap into what gives you that feeling. Like you shouldn't wake up every day like, yes, I can't wait to get to the gym or do my Zumba class. Like sometimes it doesn't always feel great at first, but ultimately, to your point, you should be enjoying it. So what is
absolutely.
the type of exercise you shouldn't be doing, outside of just the mental component of it? Like, what is going to be too stressful? So you mentioned, you want to have some sort of like almost like weight bearing activity, but having too much inflammation. So going to the gym every single day a week, doing hard, high intensity interval
Yes,
workouts, not
that
ideal.
that's exactly
Okay.
that's exactly it. So
Okay.
you want some of that, but you really don't want to go to extreme of that because we're managing that inflammation in the body. Um, so that would be the main one. I know, again, there's also this idea that, well, I'm just gonna like do like a ton of cardio. I hear that a lot. Okay, like I'm just gonna burn fats.
Mm.
And based on how our body makeup, we don't actually, it doesn't actually work quite as well in terms of keeping weight off. So a lot of folks can get really obsessed with just being on the elliptical, right? Or
Mhm.
on the
All day
bicycle,
long. Yep.
right? Exactly. And they're like, I'm not seeing any results. Your body needs a little bit more of a balanced way of movement. So even if you're doing cardio one day, you're doing gentle, start start low, start slow, work with a trainer if you can. There's tons of trainers who actually work specifically with women with these issues,
Mm,
and know exactly the exercises that are most appropriate. But again, it all comes back to what can you do consistently and
mm.
what do you love,
Yeah,
right?
and
Because
honestly,
we want
no,
to,
most females shouldn't be doing high intensity activity every single day. I mean, especially with our hormone fluctuations and stuff like that, and like you mentioned, the inflammation on the body to begin with. So,
absolutely, absolutely. The other thing that I do, I always encourage is sweating though.
mm,
Sweating is key because of the detoxification process and the fact that, there's typically a heavy toxic load
mm,
for folks with PCOS. So I always emphasize that if you can get into a sauna, or, if you're doing something that is really kind of allowing you to get your sweat on, that is really great. It also helps with the acne as well, because you're getting everything out through those pores. I find that a lot of clients say that that's quite helpful when I've made that recommendation.
excellent.
So,
So, for those of you who are in quarantine like us and can't maybe make it to your local sauna, we were just talking about how when you go for a walk, put some extra layers on and get your sweat on, and
yep,
it'll feel good. But of course, hydrate on top of that. Make sure you're staying hydrated, because if you're not properly hydrated, you can't adequately detox naturally and sweat it out. So
right.
don't forget that little hint if you're listening.
That's actually a really big, a big
Really,
part.
really big piece, right? It's water is important for blood sugar. It's important for hormones and detoxing. And I tell people, if you leave to
Digestion even.
and digestion, yeah, I tell people, if you leave today and the only thing that you learned was to drink more water, you've just improved your health in at least 15 different ways. So,
Absolutely. Even like, I talk to clients about, um, the digestive process and, having enough hydrochloric acid to break down proteins. And I'm like, water is a component of that as well. So if you're not drinking enough water, you're really doing a disservice to your entire system.
excellent. Excellent. Wow, I could talk about this all day with you. You're a really fun guest to have on. We'll have to do this again for sure.
Thank you.
So we talked.
I'm having a great time.
Good. Oh, I'm so glad. So diet, we talked about diet. Basic overview is, a balanced diet, making sure you're getting the essentials. Balancing your blood sugar is key, which is for everybody, right? We should all be focused on balancing our blood sugar for optimal hormone balance, health in general. We addressed the medications, we addressed certain herbals, we addressed lifestyle, which you mentioned. Now, what would be some things that you would suggest to clients who are really struggling with the stress part of it, or who, maybe some exercises that you have found that have been really helpful for your clients?
So before I start, or at the start of every call with a client,
Mm,
so they're all virtual now,
of course.
but I always do a breath work exercise, just to ground the energy, always.
Mm,
And I always start with, on a scale of 1 to 10, how are you feeling? And, I try to, by the end of the call, hopefully they're at a different number than they started with, if it was a low number.
mm,
So we start with that exercise. Breath work is an incredibly useful tool. I love a lot of energy medicine tools, so Reiki, anything like that that can really help to move energy through the body. Meditation, mindfulness, even incorporating that into how they eat. So having a mindful moment when they're eating.
mm.
My favorite exercise is the craisin or the raisin one. I don't know if you know that one. Have you
Yes.
ever heard of that yet? Yeah.
Yep.
So I always do that one with them, just to, because we do so many things while we're eating, while we're distracted, watching TV, on our devices. So all of those things really help to bring the nervous system down back into balance. Um,
And so
so
what
those are the
Saron is
main
talking
ones.
about, for those who aren't familiar about the craze and exercise, and correct me if I'm wrong, I've done it with
Yeah,
chocolate before, is,
yeah,
you experience the multiple senses, and you create this almost a hyper awareness of the raisin or the chocolate that you're about to eat. You notice everything about it. You put it on the tongue, you move it around, you notice the textures, the taste, things like that. And imagine eating your everyday food like that. People are probably listening going, huh, I don't think I even chewed my lunch today, So
yeah.
it's a powerful exercise. You can even look it up online and find a little meditation for it. But that's amazing. I think all of the things that you just mentioned, and they don't have to be overwhelming. The breath work, the meditation, that can be. I said to a client today, what about meditation? She said, well, I feel like it's so hard to get yourself to completely shut off. That's not what meditation is. Meditation
That's
is
it's
is
not.
it's not. It's about being able to bring yourself back, or just being able to acknowledge that you're stressed or that you're feeling, or to be able to take two deep breaths that you maybe wouldn't have taken. So we have to let go of what relaxation, what meditation, what yoga, what all of the things should look like, and just say, I am my own individual person. What feels good and what feels right for me?
Yeah, and I think too, so there's a couple of things to consider too. So um I'm very fascinated with polyvagal theory,
Mm,
and I really incorporate that a lot in my practice as well. So it depends on the client. If the person tends to be you know, in a hyper aroused state a lot, so more on the anxiety state, then you want to bring them down. But if they're more on a depressed state, you want to bring them up.
mm,
So sometimes meditation is more challenging if you're in a depressed state,
mm,
as opposed to if you're in a hyper aroused state, right? So if you tend to have a busy mind, then absolutely that's going to work more for you. Whereas someone who is more in a depressed or shut down state, I give the example of the zebra in nature, right? Like when they've been chased by a tiger or something, and they get away, they kind of do this like shake, right? They shake
yeah.
their whole body very vigorously just to kind of get the energy out, right? So sometimes more movement and then relaxation is works better than just in that kind of like I'm going to go into Zen mode. It's
Mm.
sometimes harder for some people, so it just depends, right? Where your set point is.
That makes complete sense. That's an excellent point. Now, is there anything that you feel like we're missing in terms of this episode, and like for what the listener could have before we give the main three takeaways?
I think we've covered quite a bit. Um, I, the only thing I would speak to is energy, right?
Hmm.
And I work with energy a lot. I observe clients, what their makeup is, their general energy, and work on cultivating the feminine. Like that's one of the main things with reproductive health issues. If you're very young, meaning you're very go 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 hustle grind, um, over tend to be an overachiever, type A personalities, PCOS, folks with PCOS tend to have a type A personality,
Mm.
you know,
I
in
feel like
my
you're
in my
speaking to me.
observation. Right? So how can you shift that energy into something a little bit more receptive, and maybe putting some things down? Um, what if you weren't such a perfectionist? What would your life look like? Would it be okay? Would you still be okay? Would you still be you?
Mm,
Working on that bit of it is so important. So
yeah.
that's the only thing I would really add is, if you're struggling with that, as in your life, in the way that you interact with people, because the thing is, PCOS is not just affecting your physical body, your sense of self, especially if it comes with a lot of these other external, symptoms, right? Like acne and excessive hair growth, etc. But it's also affecting your relationship with other people.
Mm.
right? And so really coming back into balance with yourself, with these two energies within you, will really help have that reflect in your outer world as well. It actually is life changing.
That's beautiful. I read The Gift of Imperfection by Brene Brown last year. I worked with a therapist who I finally found, who actually, this was one of the main things we were working on, is the perfectionist mindset and having to be on all the time and stuff like that. And I mean, I'm just oversharing my personal experience, but the way that that transferred into my relationships in life, and also how confident I felt and how I was able to be more intuitive about like so many different aspects in life, was incredible. And so thank you for bringing that to this episode. I think that that will be invaluable.
Thank you. I'm really so happy to be able to share on this topic, because I think so many folks struggle with it and they feel frustrated, like nothing is going to work a lot of the time. And there is that underlying belief that is needed, like I can heal, I can, this doesn't have to be a lifetime sentence, I'm not a prisoner of a diagnosis. There, it's really actually an opportunity to see yourself and your life in a completely different way.
Yeah, and I think we didn't really mention that. I mean, you can, like, can PCOS go away? I don't know that we can say that, but can the symptoms of PCOS go away? I
No.
would say for sure. Absolutely.
Absolutely. Absolutely. There, like I said, I don't feel like it's a life sentence. You might have periods of time when you're more stressed, and so those symptoms might come back, especially if you have a predisposition, like we mentioned, right? If
Hmm.
you have a genetic predisposition, if you switch on those genes, it's like a light switch.
Hmm.
So, what are the contributing factors that will switch those genes on? And if all of those are present, then you'll see the manifestation of it. But the opposite should be true as well. In the absence of those things, then can we shut off the gene expression?
Hmm. I want us to start thinking about these diagnoses as like a headache, right? So you get stressed, or you consume too much alcohol, or, you know, you do something that says, oh, that makes sense. I have a headache. So I want us to think about, okay, I'm diagnosed with PCOS. Okay, versus thinking of, well, like, you don't walk around going, yeah, I've been diagnosed with headache. Like nobody, I mean, if you have chronic migraines, that's obviously different. But
Yes,
detaching a little bit from that idea and understanding that there's a roadmap here of how we got there and an underlying cause, I think is, the message. So anyways, so the three main
absolutely.
takeaways, Saran, what would you give to the listener, if they're either diagnosed or feeling discouraged, whatever it is, what would be your three main takeaways?
So, number one would be gentle with yourself, be kind to yourself, and be patient with yourself. So, that's three things in number one.
Excellent, love it.
um, but that's really what's required for that first step. So when you have that self-compassion, oh, I gained 5 pounds this month. Like, are you going to freak out and be like, oh my God, it's not working? So can you come back to that center point and say, this is part of it, this is part of the journey. I'm doing the best that I can.
Mm,
Okay. So that's number one. Number two, um, you know, as I mentioned to you before, when you're choosing exercise, do something that you like to do and that you know that you can commit to, even if it's walking to start. You know what I mean? Going for a walk every day or every other day. Do something that you know that you can stick to for a particular period of time. So that's number two. And number three, um, really address the stress component, because as we mentioned before, right, it affects digestion, your hormone, everything.
mm,
So if we can, and we can't avoid all stress, like I mentioned, I said in my IGTV video, we can't avoid stress. It's just part of being human. Actually need a little bit of stress um, to keep you motivated, etc. But when you sustain chronic levels of stress, that's when it becomes problematic. So finding things that will support you relaxing more, making adjustments to your lifestyle to support that, that so that you have longer periods of rest, and restore. Um, and actually using your menstrual cycle as a blueprint, which we'll probably talk about next. Um, so those first couple of days, especially of your menstrual cycle, can you give yourself that time and space to just do nothing? Not, I know that's a privilege for a lot of folks. You still have to work and things like that, but can you give your time, can you plan your life in a way that gives you some space and some grace on those first couple of days? That alone will make such a huge difference.
Mm. That's beautiful. Well, thank you for that advice, and I'm sure the listeners will be taking notes. And everything that you just said, if you just take one of those, even just the first one is the mindset. You don't need any tools. You don't need a supplement. You don't need a pair of sneakers to do any of that. To do the first part of what you said is to start to practice self compassion, and it's similar to meditation. It doesn't look like beautiful fairyland. I love myself. I look in the mirror every day. Like, no, it's a relationship, meaning you work at it every single day.
Absolutely. You're offering yourself your humanity.
Mm,
We're all human,
hmm.
you know, we're all
Hashtag human.
imperfect. Yeah, exactly.
Yep. Now, the most important question, what is your favorite childhood memory with food?
Oh, oh, there's so many. I'm from Jamaica. This is like a very loaded question.
I'm sorry, but I'm gonna make you choose, I guess, first one that comes to mind, if you could.
Oh my goodness. Okay. So everybody, if you're from Jamaica, you'll know what I'm talking about. Hellshire fish from Hellshire Beach. Like on a Sunday when you're
Mm,
young and even when you're old, you go to the beach and you go to Aunt May's. There's all these little shacks on the beach, and they all have virtually the same menu, but you pick your favorite one.
mm.
You pick your favorite little shack, and you have escovitch fish. You have bami, which is like cassava, like a
Oh, I love
cassava
cassava.
cake, right? Um, oh, it's so good. Like, I can't go to Jamaica and not go there. But I
Wow.
remember going there as a child all the time. It's like a very um, normal thing, a regular thing to go to Hellshire Beach on a Sunday and have escovitch fish. So,
Now, are you going to be able to go sometime in the future? Like, what does that look like? Do you go back visit at all?
well, the pandemic is making things hard, but usually I go back every year. So
Okay.
last year I was there, or before the pandemic, I was there in January doing a workshop. And so that was the last time I was able to travel there. But my parents are still there. My
Oh,
grandma is there. So,
that's
I still
beautiful.
have family.
Well,
Yeah.
good. I look forward to you getting there so you can be with your family and experience that. And you mentioned, a course. So tell us about your course. Where can people find you? Yeah, where can people find you?
So I have a virtual course called Inner Seasons, a blueprint for honoring your body. And it's based on the 4 phases of the menstrual cycle. So I go through each phase as a season. So there's a natural correspondence there. And we look at how to manage your energy through the cycle. We look at nutrition through the cycle. So what's great for the follicular phase, what you want to focus on in the luteal phase of your cycle or your premenstrual phase, how to manage PMS. I also go into the herbs that support each phase, the supplements, the nutrients, etc., and really creating a map for your life using this. So you know that your serotonin and estrogen rise towards the mid-cycle. How are you going to use that energy? You have all this creative potential and creativity bubbling up, and then what to do with those more challenging emotions that come in the premenstrual phase.
Mm,
And really the course is designed to help you not pathologize your menstrual cycle. Because I think there's a lot of built-in shame around it. There's a lot of like, it's a nuisance. I really hate this thing. I hear that a lot. Rather than seeing it as something that is giving you a design for your life, for
mm,
unfolding your life purpose, for working through challenging things and giving yourself time to rest. So
mm,
we got 3 weeks of like energy and then 7 days, 7 days of, not as much energy. If you actually honor that cycle, then you will find that, other things in your life will start to balance out. So the
mm,
course is really about learning that body awareness, learning how to nourish yourself, and practicing that self-compassion piece that I mentioned before. So the course actually starts on February 28th.
okay.
The website is www.learnwithsaran.com, and it's a quite dynamic. So all the things I mentioned are in there, but I also touch on lunar cycles
Mm,
and feminine energy, and even astrology, and how all of that sort of ties in and can help to round out um, a whole a whole person. So that's
beautiful.
that's a little bit about it. Yeah.
Excellent. Well, thank you, Saran. And I look forward to checking it out myself and look forward to what I assume was your formal exception to my invitation to come back on at some point to discuss some more
Yes, I would
topics.
love to.
That would be great.
I
Well,
would
thank
love
you
to.
so much for taking
Thank you
the
so
time.
much.
It's been a great conversation and you've been incredibly informative. And I hope everybody enjoyed the episode. And I hope you have a wonderful rest of your day.
Okay, thank you. Oh, and I forgot to mention on Instagram,
Yes.
I'm at wellness_by_Saran. That's
Excellent,
where you can
Saran.
find me on IG.
I'm gonna go follow you right now. I can't believe I wasn't already.
Oh, thank you.
All right, Saran. I'll talk to you soon.
Okay, talk to you soon.